On February 21, 2024, Change Healthcare, a major healthcare technology company, experienced a significant cyber attack. This attack caused widespread system outages across the United States. These outages were immediately noticeable. Hospitals, clinics, and pharmacies were unable to access crucial data. This data included patient records, billing information, and insurance claims. The attack disrupted healthcare services across the country. Patients experienced delays in receiving treatment, filling prescriptions, and getting their insurance claims processed. Change Healthcare launched an immediate investigation. They shut down their network to isolate the intruders. The source of the attack and its full extent remained unknown at this time. The situation was dire. Change Healthcare initially attributed the outages to a cybersecurity issue. They worked around the clock to restore their systems and determine the cause of the attack. However, the scale of the breach and the sophistication of the attackers soon became apparent. The attackers had gained access to Change Healthcare's network weeks earlier, around February 12, 2024. This delay between the initial breach and the system outages highlighted the stealthy nature of the attack. The attackers had burrowed deep into Change Healthcare's system, remaining undetected while they stole data and laid the groundwork for their devastating attack. The cyber attack on Change Healthcare was a wake-up call for the healthcare industry. It exposed the vulnerability of healthcare systems to cyber threats. The attack showed how interconnected the healthcare ecosystem is and how an attack on one company can have ripple effects throughout the entire industry. The incident served as a stark reminder of the importance of cybersecurity in healthcare, highlighting the need for robust security measures to protect sensitive patient data and ensure the continuity of care. As investigators dug deeper into the attack on Change Healthcare, they uncovered a chilling truth. This was not just a random cyber attack, it was a targeted ransomware attack. The perpetrator was none other than LPHV, also known as Black Cat, a notorious ransomware gang known for its sophisticated tactics and extortionate demands. LPHV claimed responsibility for the attack. The group threatened to leak the stolen data unless a hefty ransom was paid. United Health Group, the parent company of Change Healthcare, faced a difficult decision. They were caught between a rock and a hard place. On the one hand, paying the ransom would mean giving in to criminals and funding their future attacks. On the other hand, refusing to pay could result in the sensitive data of millions of patients being released online. After careful consideration and negotiation with the attackers, United Health Group made the difficult decision to pay the ransom. In early March 2024, they paid LPAV a staggering $22 million in an attempt to prevent the release of the stolen data. The payment of the ransom sparked widespread debate. Some criticized United Health Group for giving in to the demands of criminals. They argued that paying the ransom would only embolden LPHV and other ransomware gangs. Others, however, sympathized with United Health Group's predicament, recognizing the potential harm that could be caused by the release of sensitive patient data. The incident highlighted the complex ethical and financial considerations involved in responding to ransomware attacks. The payment of the ransom did little to alleviate the situation. Shortly after receiving the money, LPAV vanished. They disappeared into the darkest corners of the internet, leaving no trace behind. It seemed like a classic case of take the money and run. However, the story took another unexpected turn. A new ransomware group emerged from the shadows, calling themselves Ransom Hub. This group claimed to be an affiliate of LPHV. They alleged that LPHV's leadership had betrayed them, absconding with their share of the ransom. Ransom Hub demanded a second ransom from United Health Group. They threatened to release the stolen data if their demands were not met. As proof of their possession of the data, they leaked a small portion of it online. This confirmed everyone's worst fears. A massive data breach had occurred. The stolen data included a treasure trove of sensitive information: medical records, diagnoses, medications, test results, treatment plans, and personal information of millions of Americans. The impact of the data breach was staggering. In April 2024, United Health Group confirmed that the breach had affected a substantial proportion of people in America. By October 2024, the number of affected individuals had climbed to over 100 million. This made it the largest healthcare data breach in US history. The breach had far-reaching consequences. It eroded public trust in the healthcare system, leaving many Americans feeling vulnerable and exposed. Victims of the breach faced an increased risk of identity theft and fraud. They were left to deal with the fallout of having their most sensitive information compromised. In the wake of the data breach, United Health Group faced intense scrutiny. Lawmakers, regulators, and the public demanded answers. How could such a massive security failure occur? What measures were being taken to prevent future attacks? In May 2024, Andrew Whitty, the CEO of United Health Group, testified before Congress. Under oath, he admitted that the hackers had gained access to Change Healthcare's network using a single password. This password was associated with an account that lacked multi-factor authentication, a basic security measure that requires users to provide 2 or more forms of identification to access an account. Whitty's admission sent shockwaves through the healthcare industry. It revealed a shocking lack of basic security hygiene at one of the nation's largest healthcare technology companies. The state of Nebraska filed a lawsuit against Change Healthcare in December 2024. Citing negligence and recklessness in their cybersecurity practices. The lawsuit alleged that Change Healthcare had failed to implement adequate security measures such as proper IT system segmentation, which could have limited the scope of the attack. The Change Healthcare data breach was a watershed moment in healthcare cybersecurity. It highlighted the urgent need for healthcare organizations to prioritize cybersecurity and invest in robust security measures. The incident prompted calls for greater government oversight and regulation of healthcare data security. It also underscored the need for international cooperation to combat ransomware gangs and hold them accountable for their actions.